It's getting better, a little better all the time.
We're back with cosmetic surgeon Dr. Nikko. We talked a little bit before about your body augmentation procedure. Now we're going to be talking breast lift. So thanks for sticking around to talk about this. And so many patients that I have talked to in the past have suffered some very serious scarring from this. And you're one of the only surgeons in town who makes sure that women can get a breast lift without having to suffer from those scars.
Yes, at Nikko Cosmetic Surgery Center, we see a lot of people who come in for mommy makeovers. And so after having 2 or 3 kids, obviously they lost volume in their breast and they want their breast lifted. But oftentimes they'll tell me they've seen 2 or 3 doctors who have told them that they have to have the typical scars on their breast, the anchor scar, and so they're not happy with that and they're not really willing to go through that. So what we offer them is this procedure where I do everything through a small incision underneath the arm is the transaxillary technique. And by using an implant and using the transaxillary technique, I can lift their breasts. People with mild to moderate sagging breasts without any scars on their breasts whatsoever.
And that has to be really big for women who want to look maybe youthful or younger. What about the people who already have the scars? Can you help them and maybe perhaps help the scarring look better?
Yeah, unfortunately, once you have the scars, they're there, and it's difficult to correct the scars. That's why we do everything we can to minimize scars. We focus on procedures that leave very little scars on the breast, so that's why avoidance is really the primary treatment.
Now, what about the recovery period for something like this? This sounds like probably a more serious procedure than the augmentation we're talking about for the buttocks earlier.
Yeah, it's a little bit more downtime, but certainly less downtime than the traditional breast lift, where it's much more invasive. With this procedure, still recovery time is no more than 1 week.
We're showing everyone here a little bit about what we're talking about. So again, you use the armpit, then recovery is minimal, which everyone always wants to get back to work usually as quickly as they can. And then usually within a week or so, you're back at work.
Right. Not only it's important to be back at work, but be able to take care of the little ones.
Sure.
And so we have a lot of mothers who just can't afford to take more than a week off. They can't get more than a week worth of
Now, it sounds like it's a little bit more than a lift because you said you also use an implant when you do this?
Yes, it's a combination of a lift with an implant, because without the implant, you really can't get the volume that you want, the cleavage that you want. So oftentimes you need a small implant to give you the cleavage.
How do you decide who is a candidate? If someone comes to you and says, you know what, this is what I'm interested in, how do you know when they're the right person for this?
Yes, that's a great question. Now, it all depends on how much sagging tissue they have, and it also depends what their goals are, the amount of lift they need. So knowing what they want and knowing what the end point is, that determines what we can do for them.
So if someone says, you know what, I think I might be interested in that, the best thing would be to I guess, come see you for an initial consultation.
Yeah, if you visit drnikko.com, our website, you can see all the before and after pictures, and you can see some breasts that, have some sagging tissue, and then you can see how we lift it, and you don't see any scars on it.
What about risk? It seems like there's always at least the typical risks that are involved with it, maybe perhaps infection or problems with anesthesia. Anything else that someone would need to worry about?
Yeah, with breast augmentation and breast lift, the main thing we worry about is capsular contracture. I mean, all the other risks are very minimal, very small, but capsular contracture is one thing that we often deal with.
And can you explain to us what that means?
Basically, it's just an excessive scar tissue production around the implant. It happens about, 5% of the time. Yeah.
Well, that's still pretty minimal, though, 5%, I would say.
Yeah.
But it's still something that they need to know about.
Yes.
Now, what about cost of this particular procedure?
Yeah, cost is, with this procedure, the primary thing is that it's certainly less than doing a breast lift and an augmentation. With this procedure, it's actually less than the typical cost. And so for this holiday season, we are also offering a $1,000 off for a Fox Viewer for any body contouring procedures.
All right, well, people will be glad to know that with the holidays coming. Hopefully they can look and feel better than ever, and then also save a dime. Always very good information. Dr. Nikko, thanks for being here today and walking us through some of the interesting things you're doing in Houston. We're lucky to have you here.
Thank you.
Appreciate it.